Hi, my name is Julie Horton. I'm an infectious diseases physician, and today I'll be answering some questions about coronavirus and infections with COVID-19. There's been a lot of information distributed by public health professionals about the idea of flattening the curve. This involves the idea of social distancing, where we try to prevent the active spread of infection so that we don't overwhelm our healthcare system. This allows for spreading the cases out over time so that we don't have a large spike, which will overwhelm the healthcare capacity. Coronavirus and COVID-19 are extremely important health issues. These diseases have been declared a pandemic and have caused illness throughout the world. Obviously, there's been a major disruption to most life occurrences, including our day-to-day activities. The biggest risk is posed to those who have underlying health issues and may be impacted severely with advanced disease and mortality. Our public health officials have determined that the best way to prevent further spread and to limit disease has been to enact social distancing. This involves having people spread themselves out and not congregate in large groups. Therefore, many sporting events and other concerts and other things where a large number of people were to gather have been canceled due to the discouragement of spreading disease from person to person. Of course, to avoid spreading infection to others, you should cover your cough. Also, to prevent infection in yourself, you should avoid touching your nose, mouth, or face. What you can do to keep yourself healthy is, of course, washing your hands. This has been a public health initiative and emphasis since the start of this disease and ought to be part of our everyday life. Of course, avoiding sick people and you yourself staying home so that you do not endanger others if you are feeling unwell. For more information, please head to our website.